Put on your PPE, the gloves and apron. Move the patient onto the floor. Place the clock near the patient. Secure the endotracheal tube using a tie. Squeeze the ambu-bag and make sure oxygen is flowing. Occlude the valve and squeeze to check for any leaks. Attach the ambu-bag to the endotracheal tube. Begin ventilation using the ambu-bag. Perform one full cycle, 2 minutes, of effective ventilation, 1 breath every 6 seconds. Communicate with the vet to switch for the compression cycles. Perform one full cycle, 2 minutes, of effective chest compressions at 100 compressions a minute. Tasks complete. Return to the main menu for more assessments.